Hi and welcome to my channel. I'm Dr. Marcus Spry. I'm a dentist in the UK and I post a new dental related video every Monday. So if you'd like to subscribe and hit that bell, ding, be grateful and you will have first view of the new video. Thank you. Okay, today's video is to understand how to avoid the need for root canal treatment. I've never met a patient who wanted to have a root canal treatment. It's something that I think most people dread, and there are ways of avoiding to have the whole process in the first place, and I think that would be a good thing to tell you about. So listen in and we'll talk it through. Okay, so the subject of root canal treatment and how to avoid it. The process basically is that if you get a cavity in your tooth, then bacteria are getting close to the nerve which is in the centre of the tooth, and they will poison by the products that the bacteria produce, the toxins that the bacteria produce. They will poison the nerve and the nerve will become inflamed, and then you start to get sensitivity to perhaps hot and cold, sensitivity perhaps when you bite on a tooth, and you may even just get spontaneous pain and discomfort. And that could be cured by extracting the tooth, but that's a little bit like getting rid of the whole situation without any regard to keeping the tooth. So you can just have the nerve removed from the tooth, which seems bizarre, but if I had a pain in my arm, I wouldn't necessarily want the nerve removed for sensation to my arm because I'd end up with a numb arm. But you can do without the nerve in your tooth. So that can be removed, and that process of removing the nerve and sealing it against bugs is called root canal treatment. But the whole thing was originally driven to that point by needing treatment of a cavity. So here's the top tips for avoiding it. Firstly, don't eat too much sugar, because if you eat a lot of sugar, the bacteria in the mouth turn it to acid, and that demineralizes the tooth, softens the tooth and produces a cavity. So not too much sugar, and certainly not too frequently. The second thing, of course, is to brush your teeth with a fluoridated toothpaste, and that will make them stronger and more resistant to the decay in the first place. The third thing is to go to the dentist regularly to get a check, because if you have a cavity and that's found early in the process, the bugs won't have got too close to the nerve in the centre of the tooth, and therefore it can just have a regular filling without needing to have the internal root canal treatment. And the fourth thing is that you perhaps should have some x-rays done once in a while, because if my hands were two teeth, you can have a cavity in the side of the tooth and then it's covered over by the next one, and you won't be able to see that at all, but the dentist can see it by having the x-ray process. It can bring him a kind of radar, an early warning way of finding that there's a cavity there. So if you have teeth treated early in the process, then you won't need to have root canal treatment. But you know, if it comes to the end of the day and you need root canal treatment, it would be better to have that than to lose the tooth, in my opinion, and that's certainly what I would like to do as a dentist. And what I do, I swear, that I would make sure that it doesn't hurt in the process. I think that's what people are frightened of, that it's going to hurt. Lots and lots and lots of local anaesthetic, utterly numb, and then you could have that treatment without it hurting. So try and keep the sugar down, keep the brushing going, go regularly and have checkups and x-rays to your dentist, and then surely you won't need any root canal treatment in the first place. Hooray! Thanks for listening. Please like, share and subscribe. Click on these boxes for more of my videos. For a smile for life.